going to simulate placing a stomach tube into a dog. So I've got my supplies here. I've got the tube that I'm going to use, some lubrication for the tube, and then the medication that's going to be passed down in the tube, and a roll of tape to act as a speculum. So first thing I'm going to do is measure the length of the tube so I know how much I can place into this dog's stomach. When I'm measuring for my tube, I'm measuring from the canine tooth to the last rib, and that's going to give me the length I need for my tube. So I can feel the last rib right here, measuring up to the canine tooth right here. And then I'm just going to mark off so I know how far to place the tube. Okay, so that gives me how much I need. So for placing a stomach tube, you want to do it either sternal recumbency or lateral recumbency. She's already laying sternal, so she's fine to stay just like that. And then I've got a roll of 2-inch tape that I'm going to use as a speculum. I'm just going to put this in the mouth so she can chew on that, and then I'll be able to pass the tube through the center of this roll. Okay, so I'll leave that in the mouth. And then I'm going to lubricate the end of the tube. Okay, so at this point I would take the tube and pass it through the center of the roll, and then just gently work it back down into the stomach. Right about here, I'd wait for her to swallow, passing it down through the throat until we get to where we have the tube marked here. So when the tube is placed into the stomach, you would then inject a small amount of sterile saline, 3 to 5 mils of sterile saline, and this would indicate if the tube is placed correctly where it should be in the stomach. If it's not, she will cough and it'll sound water in the lungs, and that's how we would know. And then if it's placed correctly in the stomach at that point, and she's not coughing it up, but it's actually in the stomach, we could then inject the medication into the end of the tube for whatever medication that she needs given into the stomach. Once the medication's been given, we just gently back the tube back out, slowly without forcing, until we've got it back out comfortably without hurting her, and then take the speculum out. You can know that the tube is placed correctly in the stomach by making sure she's not coughing. In an awake patient, they will not easily let you put it into the trachea rather than the stomach. They would resist against that, so you would have a hard time doing that. She would cough if it was into the trachea, and then into the stomach you'll be able to see going down the throat also when she swallows. And that is a simulation placing a stomach tube in a dog.